Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, fluorescein angiography. This fluorescein angiography will help us to study the normal physiology of retinal and choroidal circulation. That is how the retinal and choroidal circulations are found out, are going on, and whether there are any abnormalities in the retinal and choroidal circulation is found out by fundal fluorescein angiography. So if you see the procedure of fundal fluorescein angiography, in fundal fluorescein angiography, we actually give the patient 5 ml of 10% fluorescein is injected into the antecubital vein. So 5 to 10 ml, 5 ml of 10% fluorescein, which is actually a fluoresceinating, that is a substance which gives light. So fluorescein is injected into the antecubital vein. So from the antecubital vein it goes to the circulation of the body and it reaches the retinal vasculature and choroidal vasculature, and photographs are taken at first after, just after taking it, giving this fluorescein dye at 1 second interval, we take photographs, and then we take photographs between 5 to 25 seconds after injection also. So we take photographs at 1 second, and between 5 to 25 seconds after injection we do the fluorescent, we take the photographs, and these photographs will look something like this. So this photograph shows the fundus fluorescein angiography. Actually, this fundus fluorescein angiography has three phases. This can be either normal or hypofluorescent or hyperfluorescence angiography may be seen. The angiography can be either normal or hypofluorescence or hyperfluorescence. Actually, this is the normal fundal fluorescent, normal angiography or fluorescein angiography. So this is normal. So there can be hypofluorescence or hyperfluorescence also. So what is when do you see hypofluorescence in fluorescein angiography? In fluorescein angiography, hypofluorescence is seen if there is any leakage due to retinal pigment epithelial defect. If there is some leakage in the retinal pigment epithelial defects, or if there is leakage or retinal pigment epithelial defects, then fluorescein angiography is uh, hypofluorescence. But the difference between leakage and the retinal pigment epithelium can also be found out by this investigation itself. If there is leakage, we see increase in size of the fluorescein. So this fluorescein vessels, you can see these vessels will be increased in size if there is leakage. If there is uh, size of the retinal pigment epithelial defects, if there is some retinal pigment epithelial defect, then the size of these vessels will be completely normal. This is for hyperfluorescence. This is hyperfluorescence. Leakage and retinal pigment epithelial defects are seen in hyperfluorescence. Then second, we have hypofluorescence. In hypofluorescence can be due to blocked fluorescence. If there is blocked fluorescence, obviously there will be decreased fluorescence. This blocked fluorescence can be either due to the hemorrhage, or it can be due to exudates, or it can be due to capillary non-perfusion. So whenever there is hemorrhage, exudates, or capillary non-perfusion, then there can be hypofluorescence can be seen. So this is fluorescent angiography.
thank you and thank you for watching.